All right, next we're going to look at bone disorders. And these are imbalances between bone deposit and bone resorption. Those are generally what tend to underlie nearly every disease that affects the human skeleton. We're going to look at three major bone diseases: osteomalacia and rickets, which are similar to each other, osteoporosis, and Paget's disease. But first, let's talk about osteomalacia and rickets. Both diseases are caused by vitamin D deficiency or insufficient dietary calcium. So that produces bones that are poorly mineralized, that are mostly just collagen and quite bendy because they don't have calcium salts adequately deposited. So they have soft, weak bones. Osteomalacia is usually what we call this disorder when we see it in adults, and we call it rickets when we see it in children. Both can result in bowed legs, other bone deformities, and bones that are really enlarged and abnormally long. But we can also see quite a lot of pain when individuals try to put weight on these misdeveloped bones. Here we can see osteomalacic bone compared to normal bone. So it's not as dense as normal bone because it's missing a lot of that hydroxyapatite salts. It's missing a lot of the calcium phosphate. So causes of osteomalacia besides vitamin D deficiency might be celiac disease, which resists or prevents a lot of absorption of nutrients, including vitamin D, but also of calcium. Kidney or liver dysfunction and even anti-epileptic use can cause osteomalacic bone. Next, we're going to move on and look at osteoporosis. And that's actually a group of diseases in which bone resorption exceeds deposit. So while the matrix remains relatively normal, bone mass declines. It creates kind of spongy, porous bone, and we see this affecting most the spine and the neck of the femur. They tend to be the most susceptible. That makes vertebral and hip fractures very common. Here up at the top on the left, you can see normal bone, compared to, at the bottom on the left, osteoporotic bone. So osteoporotic bone is actually porous bone. It's not specifically demineralized or missing the organic components. It's just bone that's being broken down, making it quite weak. Now there's our risk factors for osteoporosis. We tend to see it a lot in aged postmenopausal women. It actually affects 30% of women aged 60 to 70 years and 70% by age 80. That's because estrogen plays a role in maintaining bone density. And in menopausal women, we see a very drastic estrogen decrease over a pretty limited amount of time. And after menopause, that's when women run the highest risk for developing osteoporosis. And then men are a lot less prone due to the protection that they're given by the effects of testosterone on bone. And we see less of a drop in testosterone or a severe drop in testosterone over a man's life compared to a woman with her estrogen. But there are, of course, other risk factors for osteoporosis. You've had insufficient exercise, you haven't stressed your bone throughout your life, you've kind of consistently had a diet poor in calcium and protein, smoking, genetics, and even hormone-related conditions like hyperthyroidism or diabetes mellitus, or even consumption of alcohol or certain medications. These can all increase your risk for developing osteoporosis. So how do we prevent it, or how do we treat it? Well, traditional treatment is prevention, doing weight-bearing exercise, making sure you get enough calcium and vitamin D. And then if you have osteoporosis, there's bone-sparing drugs that inhibit the osteoclast from breaking down your bone. And then last but not least, we're going to look at Paget's disease. This is a condition that is characterized by excessive and haphazard bone deposit and resorption. So we have both bone growth and bone breakdown that is abnormal. When the bone growth occurs, the bone grows really fast and develops poorly. This bone is called Pagetic bone and tends to be really high in ratio of spongy bone to compact bone and has reduced mineralization. And it can create heavy deposits that cause pain in the spine, the pelvis, the femur, the skull. But it rarely occurs before the age of 40, and we're not quite sure about the cause. It's possibly triggered by a virus. But treatments do include drugs like calcitonin and bisphosphonates. Here we can see an image of normal bone at the top left and Pagetic bone at the bottom right. So you can see kind of the difference in density around the hip. And whereas normal bone has kind of the same amount of spongy bone in certain places compared to compact bone, we see differences in compact to spongy bone with Pagetic bone. We also see are seeing oftentimes with poggetic bone bowing and a thickening of the compact or cortical bone. We can see an increased opportunity for fraction because of bone resorption in other locations, and sometimes an increase in blood vessels to this new fibrous tissue that is developing that we call poggetic bone. So again, this is still a condition we don't know a lot about, but just like the others, it is characterized by abnormal bone resorption and also abnormal bone deposit. So that is it actually for chapter 6 and looking at the skeletal system and bone, both microscopic and growth, and kind of how it's made and what it does and what can affect it. So if you haven't watched all the videos, make sure you do so. So maybe these conditions and words like bone resorption or bone deposit can make a little bit more sense. Again, make sure to review, but that's it for chapter 6.